DOLA patient-ready orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. The neutral patient-ready orthotic promotes normal function and reduces tissue stress from daily activities, work, or sports and exercise. This video will help you identify which of your patients will benefit from adding the neutral orthotic to their treatment plan. What type of foot will it help? What does it look like and how does it function? What conditions will it help? And why will this patient-ready orthotic help your patients? The neutral foot can present with pathologies relating to daily activities, sports or exercise, and occupational demands. From the posterior view, this foot may present with the calcaneus vertical, or very mildly inverted or everted in the frontal plane, with even malleolar curves and the toes equally visible on the medial and lateral sides. From the medial view, this foot will present with a normal medial longitudinal arch height, with equal talar head palpation both medially and laterally. From the medial oblique view, the talonavicular region does not present with a bulge or is hollow. Using plantar pressure analysis, this foot will present with a normal pressure pattern with no focal high points or abnormal pressure areas. The neutral foot will present with normal patterns of proximal function at the ankle, knee, and hip in the frontal, sagittal, and transverse planes. It will display an optimal pattern of high gear toe off through the first MPJ, with good windlass function of high range, low force, and immediate activation. The forefoot will be stable during propulsion. The neutral foot will also present with a relatively normal or only mild variations to the expected gait timing events from heel strike and foot loading through midstance and into propulsion and toe off. Despite relatively normal foot function, your patient may still present with pathologies relating to their lifestyle or other factors. Your patient may present with pathologies relating to the demands of daily activity, sport and exercise, or their occupation, pushing tissues beyond their functional capacity while still displaying normal or only mild variants of foot function. Poor footwear choice, low tissue capacity, previous injury, age-related changes, or an underlying disease process may all link to the pathological presentations, including forefoot pathologies, general forefoot pain or metatarsalgia, neuroma symptoms, or metatarsal capsulitis, bursitis, or neuritis. Midfoot pathologies, including plantar fascia or medial arch strain, mid-tarsal joint or Lisfranc injuries, or midfoot osteoarthritis. Rear foot pathologies, including plantar fasciitis, plantar heel pain, or fat pad syndrome. And lower limb or ankle pathologies, including Achilles tendinopathy, gastroc or soleus pathology, or lateral ankle instability. Or leg, knee, hip, and back pathologies, including those affecting the patella or patellofemoral joint, the meniscus, sacroiliac joint, or the lower back. The signs may already be there in your current treatments, giving you the confidence that the neutral orthotic will help your patient. Have you had success with general foot taping, a footwear change to a more supportive or cushioned style, a stretching or strengthening program, improved capacity of the pathological tissue, or treatment-directed testing of a medial arch pad or heel raise? Or has your patient had previous insoles? All of these may indicate that the patient-ready neutral orthotic will be a successful option. So how does the patient-ready neutral orthotic help my patient? This orthotic design promotes normal function and reduces tissue stress from daily activities, sports and exercise, or work. Stable rear foot control. The rear foot platform provides stability for the transition from heel strike to mid-stance and during foot loading. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion. It improves the windlass activation, forefoot stability, and promotes a high gear toe-off. The lateral arch support stabilizes the foot and promotes transition from heel strike to toe-off. The mild heel raise improves sagittal plane transition from mid-stance into propulsion. The full-length Performance EVA shell provides the combination of cushioning control needed by this foot, and the luxury DuraFit top cover is designed for both daily and sporting activities. For more options to fix the feet that walk into your clinic every day, see the full patient-ready range and be sure to check out the rest of the training modules. Need help finding the right orthotic for your patient? Use our online Orthotic Selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dolarorthotics.com.